Good evening. Welcome to this very special Ask the Expert event focused on breast cancer, from diagnosis to treatment and survivorship. Tonight, in honor of Breast Cancer Awareness Month, we have a dynamic cancer fighting duo here to share important information about screening, lifestyle changes, and personal breast cancer stories. We will also answer your questions live. To submit a question for our panel, simply drop it in the chat here on Facebook. Let's meet our panelists. First, we have Dr. Maitreyi Sarma, a board-certified medical oncologist with Mary Washington Medical Oncology. Next, we have Brett Hines. Brett is a mom to 3 boys, a Fredericksburg resident, a cancer survivor, and one of Dr. Sarma's former patients. Welcome to you both. It's so exciting to have you here this evening. Brett, we'll start the program tonight learning a little bit about your personal story. You're very active in your community when it comes to sharing your story and inspiring others to get screened and take control of their health. So please just tell us a little bit about your journey with breast cancer.
Well, thank you, Emily. Thanks for having me. And yes, I do feel a tremendous responsibility to share my story. So, as Emily mentioned, I'm a mom of 3 boys. I was breastfeeding my youngest son, Radley, who was 3 months old at the time. I'm in the rocking chair, getting ready to put him to bed, and nursing him as I did my other sons, and felt a lump, and quickly thought, that's okay. It's probably something related to breastfeeding. This can be a very common thing, but raised it to my husband, who said, well, it wouldn't hurt to call Erin, my midwife, at OBG, and chat with her about it. And I had a conversation with her, and the next day I went in, and she's so calm, but she said, let's just go and have it checked out. Let's send you in to get a mammogram and an ultrasound. And so a couple weeks later, I went in for my mammogram and my ultrasound. And at 37 years old, with no family history, not really any warning signs physically, I was diagnosed with stage 2 triple negative breast cancer. Um, I, I was immediately flooded with emotions. That was my first mammogram and screening, and it led to a cancer diagnosis. And my life from there would just be life before breast cancer and life after breast cancer.
Wow, thank you, Brett. It sounds like a very much a whirlwind sort of process that you went through from, discovering a lump in your breast and moving forward from there. Can you share with our audience the most challenging part of your treatment?
Yeah, I think the most challenging part is just the inevitable loss of control. I was very fortunate to have Dr. Sarma and Dr. Blanchard and an amazing care team who brought me along the journey every step of the way and explained to me how we were going to navigate through this and how they would support me through this. But there are a lot of decisions that are not left to you to be made, and because they can't be, because there are actions that need to happen really quickly in order to take these life-saving measures. And so I think that can be a challenging component. And I think, really having to realize that the way that you show up each day is going to look different for a little while. And that is an adjustment as a mother, as a wife, as someone who was working at the time. So I think that's a challenging mindset that you have to shift to.
Yeah, well, that actually brings up a great point, Brett. When you feel like that loss of control and really putting your faith and your trust in your providers and your support network, what helped you stay motivated and stay hopeful during your journey?
Yeah, there was a couple of things. One, I wouldn't say it was like one big moment with my care team. I think there was just a lot of really consistent moments of them showing up for me and showing up for me, like the whole me, just not the patient, like Brett the mom, Brett the wife, like what mattered to me. Like this was a silly thing, but they knew I liked to look at my labs every Friday when I came in. Like that gave me some type of sense of control of like, okay, I'm doing the right things to maybe hopefully control these labs looking really good so I can keep getting treatment every Friday. And so every Friday they made sure they had those. And it was just a little thing that they remembered and that they knew. They knew that it was kind of like a little date with my husband and I. When we would come in every Friday, he would be there. And so it was just all of those little moments of showing that they were there to support me, not just as a cancer patient, but as a person. And I think outside of what I receive from the care team is the support that you get from your family, from your friends. It's hard to ask others to step in and help sometimes. And this is a moment where, in doing that and allowing people to help you, you're not only helping them feel like they're supporting you and they're on the journey with you, which is very therapeutic for the ones that are surrounding you, but it also allows you to take some things off of your plate and really focus your time and your energy on those moments that matter and really bring you joy, like celebrating things with your children, or being able to go for a walk when it's beautiful out, and not having to worry about, is the laundry caught up. So I think just having a support system there to help you with some of those day-to-day things that become a really heavy burden when you're trying to choose how you spend the time in which you feel well.
Wow. So it sounds like, your care team understood some of those needs that you had just from that relationship and that communication that you shared with each other. The Friday lab dates for reading those results, that's definitely ringing a little true, because we have seen just on our Facebook page, whenever we've posted about Dr. Sarma, her colleagues and their practice, we tend to get a lot of just outpouring of love and appreciation for Dr. Sarma, as we're hearing from you today, Brett. So let's shift gears a little bit and switch over to Dr. Sarma. Can you talk to us about, just from your perspective, what it's like to support a patient like Brett through a breast cancer journey, and what stands out about your approach to treatment and recovery?
Oh wow, Brad, this is unfair. You cannot start off by making me so emotional. Brad, it is such a privilege, has been such a privilege being your oncologist. On paper, it might feel like I'm the one taking care of my patients. I was the one taking care of Brett. But the truth is that they make me a better oncologist. Patients like Brett make me a better oncologist. I learn as I watch them, right? The thing about Brett and these amazing patients that I have the privilege of meeting every single day is they meet me on the worst day of their life. There's no question about it. Going back to Brett's point, there's a before and there is an after when it comes to the word cancer being introduced into your life, right? You cannot change that. But the remarkable grace, the resilience, Brett showed through her entire treatment phase. I'm just in awe, really, just in awe, because a huge part of being an oncologist is, yes, understanding the medical aspects of cancer treatment. But I think something that's equally important is understanding the patient in front of you. And what was so amazing about Brett was her ability to always keep communicating with her care team. The good, the bad. Oh, with the last cycle of chemotherapy, this is how I felt. Oh, that little tweak we made, that little modification that was made, that made me feel better. I think that kind of back and forth, the communication between the one who's undergoing treatment and the one who's giving her treatment, makes a world of a difference. And I think it was amazing to see how Brett would be able to tell me how each cycle of treatment affected her differently. And, that's one of the many points I try to stress. Communicate with your oncologist. We are on your team. Please do not think that you are bothering me, because it is my duty to take care of you, right? But I think what's been even more remarkable is what Brett has done after completing her cancer treatment, her willingness to step up, talk about her cancer journey, raise awareness, be an advocate. She didn't have to do that. Brett, you didn't have to do that. But you show up every single day doing this. Oh, wow. I'm running out of words to, just tell you how proud I am of you and how much I've learned just watching you over the past few years. And not to forget the billboard that I pass by every single day. That amazing, amazing billboard. Yeah, but patients like Brett make oncologists like me better oncologists. I think I learn as much from patients like her as they do when they get care from me.
Yeah, that's an
My
incredible
water, I should have
relationship.
had my tissues. You're-
This is turning into one of our clinic catch-up for the first 10 minutes are spent just talking about life.
But it's true, like every message I had for you, every note I had for you, you were there. And that's again just one of those to like the consistency of all of these little moments is what made a difference. So
It takes a village.
Well, this is good. So our audience tonight is not just learning about you know, diagnosis and treatment and survivorship of cancer, but also really how important it is to maintain clear communication and share everything with your provider because that ultimately affects your experience and your outcomes. Dr. Sarma, when we heard Brett speaking earlier, how she really sort of offhandedly found a lump in her breast at age 37. The screening guidance that we see a lot during October and Breast Cancer Awareness Month is that women should start getting screened at age 40. So can you talk a little bit more about screening criteria and if there are certain people who should start getting screened earlier?
Oh, this is such an amazing question and also such an important question. One thing I have definitely been noticing in my clinic is an uptick in the number of women in their 30s who have been getting diagnosed with breast cancer. It also goes to show how, there is so much research left to do when it comes to this very specific population of patients who are diagnosed with breast cancer. Because you're absolutely right, our current guidelines actually talk about starting your breast screening at the age of 40. And the guidelines might differ depending on which society you're talking about. The USPSTF talks about, yes, sure, start at the age of 40, make it a biennial screening. But I think the guidelines that a huge number of oncologists tend to rely upon is the guidelines from NCCN, which talks about getting annual mammograms done starting at the age of 40, right? Screening mammograms still are the gold standard when it comes to diagnosing breast cancer. But there are certain caveats to that which are important to remember, right? When we talk about screening mammograms, we are talking about women at an average risk for breast cancer. But what if you have a strong family history of breast cancer? How does that change the manner in which you get screened? What if your last mammogram showed that you had a high risk for breast cancer? How does that change the guidelines for you? Of course, there's a lot of nuance, and this is where it is so important to talk not just to your primary care doctor, but also ensure that if you have concerns because you're at a high risk for breast cancer, you ask them if this is something where they need to be seeing a high risk breast cancer clinic, right? Because what clinics like this bring into the care for a patient are they acknowledge the nuance. Are you someone who's going to require a mammogram that alternates with an MRI of the breast? Are you someone who's going to require to be placed on a medication to help decrease the chance of cancer happening in the first place? Do you require genetic testing, right? So it is not just about, when we talk about screening, it's not just about the imaging modality. There are so many other aspects to it. But it goes without saying, women who were diagnosed with breast cancer in their 30s, which Brett would have fallen under. She wouldn't have qualified for a mammogram. She doesn't have a strong family history. There was nothing in her story that would prompt concern. It's those women who deserve so much more research, so much more money being invested into figuring out why is this happening? What can we do to improve outcomes for fabulous women like Brett in their 30s who get diagnosed with breast cancer?
Yeah, that's great advice. Thank you. Brett, you mentioned earlier, how feel like it's your personal mission to go out and share your story and raise awareness and encourage your friends, your family, the strangers on the street to pay attention to their health and get screened. Tell us a little bit more about how your life has changed since diagnosis and recovery. Um, for example, are there any misconceptions about survivorship that you'd like to address or, elaborating more on what breast cancer awareness means to you now?
Mhm. Yeah, trauma changes people, right? And breast cancer is a very traumatic experience. And I absolutely will say that when I say there's life before cancer and there's life after cancer, there are significant changes in the way that I live my life today versus 10 years ago. Um, I prioritize my health in a really big way. I think as a mother, a caregiver, wife, whatever your role, it's really easy to focus on supporting those around you. And in order for you to show up your best self and to be here in a meaningful way and a long way for your kids and those around you, you have to take the time to focus and prioritize on your own health. And I took that much more seriously. So I ensure I get enough sleep. I eat the right foods. I exercise every single day. I no longer drink alcohol. So if there is any place or any opportunity for me to lower the risk of reoccurrence or to be in a place where I cannot show up in the way I want to for my kids, like I will do whatever it takes to ensure that I can be here in the best way as long as possible. So yes, lots of changes in life. I think survivorship, that's an interesting question. And I'll be honest, I don't know that I'm there yet. And so I think I say, I feel very grateful that I'm where I am and that I came out with a complete response and that I am in a place where at this moment, I am cancer free. However, I also am very aware of the fact that there is a high risk of recurrence for the type of cancer that I have within the next 5 years. And so I think I'm still in a place of this warrior mindset a bit of that this will not come back and I will be here and live a long, healthy life. And so I don't know that I've fully moved to the survivorship place quite yet, but appreciate hearing it and appreciate feeling really grateful that I've gotten through what I have and that I'm on this side of it in this moment.
So you're in the stay vigilant camp right now.
I am very much in the stay vigilant camp. And I think that's probably also part of the reason why I feel so strongly about advocating for others and not just advocating in breast health, but in general, taking care of yourself as best you can.
Yeah, that's great advice for our viewers out there. Dr. Sarma, from your perspective, is there anything that you would add to Brett's comments about just moving through to survivorship and guidance for people who may be following in Brett's footsteps?
I have to start by saying that the word survivor doesn't do justice to you, Brett. I think we have to find something different. We have to go with the word, let's say, conqueror. It does complete justice to the warrior that you are, really. But you're so right, How do you hold space for joy in life while balancing the fact that this is something that happened to you and it's such a duality to live in, and you do it with much grace, even though you don't have to, right? But it goes to the point of how important it is for us to focus on survivorship for our patients. it can never really be, yay, you're done with treatment. That's it. The story ends here. Just go on out there into the world. I think one of the reasons why we insist as oncologists that patients keep following up with us is so that, we always have your back, right? Both in the actual medical sense, but also knowing that over here, that we are there for you. And this is something I always like to remind patients that if there is any symptom that bothers you, rather than spending a few days to weeks or months until your next appointment trying to figure out what the symptom could be, reach out to us. Make it our problem, make it my problem. We will figure it out together as to whether this is cancer or not. Because the one unfortunate thing amongst the many about a cancer diagnosis is that it doesn't spare you from the usual ahs and ahs of life, right? That still continues, but how do you know if that little bit of an ache over there is from the way you exercised last week, or is it because of cancer? And again, it goes to show the importance of survivorship that I hope you always know that we'll have your back.
Mhm.
But
It's so true. Like the moment after we were saying earlier, it's like this bittersweet moment when care ends. Like, why am I sad that I'm not coming for chemo every Friday anymore? Like that's weird, but the connection and there is the continued support once you finish that treatment. And I think that's so important because it would be an awful feeling to feel like it just ends when you finish, when you ring that bell. Like yeah.
it doesn't. Yes, of course, the bell is meant to be something jubilant, something to celebrate the end of something, but it also means that you're putting your toes into survivorship, which is its own
Anything.
shelf. But again, a huge part of survivorship that we do like to remind people we have taken care of is that we are still your team. Just because we see you less frequently doesn't mean that I'm not your oncologist. I think one of the things I like to tell my patients is that unfortunately, once you get diagnosed with cancer, you have a permanent date with your oncologist. We are always going to be taking care of you, right? But I think one of our goals for the future at Mary Washington at our breast clinic is to hopefully have a complete survivorship clinic under the roof of the cancer center where patients can continue to have holistic care that takes care of different aspects of their health, not just cancer related issues, but ensuring that they have psychological support, ensuring that someone is monitoring for side effects post completion of treatment, because we are aware there are short term and long term side effects, but also knowing that your survivorship team is constantly in touch with your oncology team.
Mhm.
Important for us to have big goals like that from the survivorship standpoint. Again, communication ends up being the most important part once somebody transitions into survivorship. When you see me every 2 weeks, I get to notice something even before you tell me. But when I see you every 3 to 6 months, to a certain extent, I'm reliant on my patients to communicate with me. So that connection should never end. I think that's the most important part of survivorship for me.
That's amazing insight into some of the teamwork that goes into supporting patients who are on really any cancer journey. Dr. Sarma, you mentioned the multidisciplinary breast clinic and some of the specialties that are involved there. Can you just elaborate a little bit more on how all of the providers within that breast clinic work as a team to support patients throughout their journey?
Absolutely. It goes without saying that, like we were talking about before, it takes a village to take care of someone with cancer, right? And the way the multidisciplinary breast clinic started off was that the idea that for someone with breast cancer, you need a surgical oncologist, a medical oncologist, a radiation oncologist, a counselor, a social worker, a cancer navigator. It's a huge team. You need a fabulous infusion team, your nurses taking care of you. And one of the questions that we had in our mind was rather than a patient who's just being told that she's got breast cancer, having to drive from clinic to clinic to clinic to see each of her providers, what if her care team puts in the effort to stay at one location and the patient comes to see us over there without having to drive from office to office to office? So that's what we have started doing with the breast multidisciplinary clinic. And a huge part of it was learning from the experiences of patients like Brett, right? And it goes back to the point again that Brett also made me a better oncologist while I was taking care of her. And it's patients like her who told us that this is important. Do not make us run around the city for our cancer care. So, what happens on Thursday mornings is that our fabulous breast surgeon, our radiation team, me, our cancer navigator, our social worker, our counselor, we all gather together to meet patients who have been diagnosed with breast cancer. They stay cozy in a room while we go one after the other to meet this patient and answer their questions, right? So instead of this being multiple appointments, patients get to have all their breast cancer related questions answered during one visit. So, yeah, that's what multidisciplinary care is supposed to be. Less driving for the patient, less moving around from clinic to clinic for the patient. The providers do all the work. All the patients just come to us in one location.
That's beautiful. If there was a heart that I could put on this call right now, I would put the heart. That's tremendous.
Yeah, Brett, and it really goes back to what I learned from seeing people like you. And we had the privilege of having an amazing team of people who are willing to do that. Support from the administration for something like this to work out. And the hope is that, with each passing year, we are getting better and better when it comes to taking care of our patients holistically, all around.
Yeah, that's an incredible resource for our valued patients like Brett and for members of our community who might not know that this resource exists and that we're here for them and in one spot to hopefully try to take some of the complication and the stress out of facing a cancer diagnosis. I know. Oh, I'm sorry. Go ahead, Dr. Sarma.
Massage therapist. Oh my. That is the icing on the cake. So patients who come to our clinic now also have access to a massage therapist, which is amazing because sometimes while they're getting chemo, it's very adorable. As a matter of fact, I cross over to the infusion center to talk to my patients, and they're fast asleep because they're getting a massage. I'm like, maybe I should come back later. That is also multidisciplinary care.
Well, we're taking care of every facet of a patient, right? So trying to take some of that stress away and make someone feel more comfortable in their body is not a bad thing for sure. We do have a couple of questions in the live Q&A. We've got members of our community out there who are excited to speak with you both and get your input and your guidance from your own personal experiences. So Dr. Sarma, of course, we have a couple questions for you from our audience. We have a question about some specific therapies. So how would you respond to someone with a serious cancer diagnosis who doesn't want chemotherapy, medication, hormone therapy, really only wants to focus on holistic treatments? From your experience, what guidance would you give someone in that position?
Such a good question. I think this is a huge source of interest in oncology as to what are the treatments that we can offer to patients that don't fall within the classic, box of what we consider to be Western medicine, right? It also goes to one of our future goals is to have a department of integrative medicine that takes the best of Western medicine, Eastern medicine, multiple healthcare philosophies, and incorporates that. So there are examples for this which have a huge body of evidence that's supporting them nowadays, right? So one of the big examples I give to patients is when it comes to chemotherapy induced neuropathy, where the neurons in your fingertips and toes get affected. There's a growing body of evidence talking about the role of acupuncture when it comes to taking care of this side effect, right? The second part of it is when it comes to herbs and supplements that could potentially have a role to play. That is something where we have a huge number of scientists and medical oncologists trying to work on trying to understand what are the so-called alternative treatments that we can offer to patients as an adjunct to whatever treatment we usually give them. And this is where having a Department of Integrative Medicine really ends up being useful. There are many apps nowadays that talk about, and Memorial Sloan Kettering has one such example, where you can look into, type in the name of a certain herb and see what effect it has on your cancer, right? This again is one of those important questions where I tell patients, talk to me about it. I'm going to try and find a place where integrative medicine can be offered to you, while also talking about how Western medicine can work along with it to help improve your outcomes. I don't think it has to be one versus the other. I think there's a role for everything to work together too.
Thank you. Dr. Sarma, there's another question out in our chat specific to imaging for women with dense breast tissue. Is it recommended that women with dense breasts get yearly MRIs, instead of or in addition to a mammogram?
Such an amazing question. Again, a huge field of study, something that our radiologists talk quite a bit about. The guidelines have changed such that nowadays you will notice that in your mammogram, it will actually tell you whether you have dense breast tissue. So the recommendations have changed to mandate this being mentioned in your mammogram results. But I think the other part that is useful when it comes to understanding whether or not you're going to need an MRI is you get a score, the thyrocusic score, that mentions what your risk for breast cancer is. And if it's noted that you're at a high risk for developing breast cancer, you actually automatically can start talking about alternating your mammograms with your MRIs. Always make sure that when you get your mammogram report, always review it with your ordering provider. Don't just look at the end section that says no evidence of malignancy and move on with it. Always make sure that you review every single detail of your mammogram with your ordering provider, because it does have clues and tells you whether you could benefit from an alternating MRI.
Great. Thank you, Dr. Sarma. One more question for you, and then we have a question for Brett before we close for the evening. So, Dr. Sarma, one more question for you. Have there been any new advances on the hormone pill that reduces the occurrence of breast cancer? And if so, what is the rate of reoccurrence?
Oh, excellent question. When people talk about the hormone pill, I'm assuming they're referring to the anti-estrogen therapy that is very specifically given for a kind of breast cancer that is hormone receptor positive. These are one of the oldest drugs that we have been using in breast cancer. And as a matter of fact, this is also a huge field of study, newer, better anti-estrogen medications. And even since the days of tamoxifen and anastrozole, there have been much newer versions of it that are already being used in our clinics. And SERM, SERD, these are all the new anti-estrogen drugs, are actively being studied in clinical trials. The next few years are going to be so exciting when it comes to seeing all the new drugs that are going to get approved. I just got back from a cancer conference where the main topic of discussion was actually this: what are the new age anti-estrogen medications that are going to be released sooner rather than later?
All right, well, that sounds very encouraging. So we'll look for more information on that, I'm sure, coming soon in the news. Brett, one final question for you. What advice would you give to someone who is just starting their own breast cancer journey?
Yeah, I think allow yourself to move through all of the emotions. Give yourself permission to grieve the news, to to think about how you might potentially learn from this news as you navigate through, but don't get stuck in that place of grief. And I think there's something to be said for the approach of having this fighter warrior mindset. Life is beautiful. There's so much to live for. There's so many joys in all of the moments, and nothing should take that away from you without you putting up a fight. So I think there's a huge mental component to your journey through navigating through care. So my advice would be get ready, prepare yourself, and you're going to fight like heck, and that's a good thing.
All right, I love those strong words, fighting words against cancer. So before we close for the evening, if there's really just one thing that you want our viewers to take away from this session tonight, Brett, what's that one thing for you? The one takeaway that you want people to have from this session?
Don't get caught up in life and dismiss something about your body. Be in tune with your body. If something feels off, communicate it, prioritize that. Your health is the most important thing in life. So make space for it always.
Thank you, Brett. And Dr. Sarma, for you, what's one key takeaway that you would like our audience to come away with this evening?
Listen to Brett, but also get your screening mammograms done. You feel something, see something, please go and talk to your provider about it right away. Don't postpone this for next month, next year. Nope. Listen to your body.
Thank you. Great advice. Dr. Sarma, Brett, thank you so much for being here this evening to share your personal stories, your experience, your expertise on breast cancer. Breast cancer doesn't just do its thing in October. It's something that affects people all the time. So this recording will live here on Facebook, and I believe it'll get posted to our YouTube channel also. Feel free to share it, pass it around to your friends, to your colleagues, because breast cancer doesn't just stay in October. This message, this advice needs to live all year round, so that we are in Brett's Stay Vigilant camp and protect our health. So we appreciate our panelists and our viewers for tuning in to this Ask the Expert session. If you have questions about Mary Washington Healthcare's cancer survivorship or support services, we invite you to visit our website for additional resources. You can find us online at cancer.mwhc.com. And be sure to watch the Mary Washington Healthcare Facebook page and other social media channels to stay informed of the latest health and wellness information for our community. We thank you again for watching, and we wish you a safe and healthy October and every month. Have a great night.
Thank you.